Welcome to the Fearless Family Health Podcast. In a world that is filled with fear, my hope is to bring you inspiration, information, and support to live joyfully and more healthfully. Join me as each week I will bring you empowering tips as well as interviews with parents, doctors, and experts to bring you vital information to make you the master of your family's future. Hello, everybody. It's Dr. Cheryl Schmidt with Fearless Family Health Podcast. Thank you again for joining us for another podcast. Today is a topic that is near and dear to my heart because I lived and learned this, and I am constantly learning and striving to learn more about the fourth trimester and just taking care of myself as a mom and a woman. Today, we are going to talk about what the fourth trimester really is and some things you can do to help support your health, your wellness for you and your baby during this time of life and beyond. So today, I have with me Dr. Jennifer Anacker. She has a bachelor's degree in biology from South Dakota State University. She is a doctor of chiropractic from Palmer College of Chiropractic and has been a chiropractor for 17 years. She is the owner of 2 chiropractic offices in Boise and Meridian, Idaho, with emphasis on preconception, pregnancy, pediatrics, and family care. She has extensive pregnancy and pediatric studies through the ICA Pediatrics, the ICPA, which is the International Chiropractic Pediatric Association, Dr. Claudia Onrig and Dr. Monica Berger programs, and Dr. Marcia Schaefer's preconception program, Truth About Fertility. She is a member of the Idaho Chiropractic Physician Associations, the ICA, the ICPA, and the League of Chiropractic Women. She has been a guest speaker and interviewed for various topics such as business, women in chiropractic, women's health, pregnancy, and family health topics. She has been recently interviewed by Dr. Heather Deniston, a chiropractor blogger and author of her Facebook show, The Junk You Should Know Show. I am so excited to introduce you guys to Dr. Jennifer Anacker. She has some valuable information today. You need to listen in, especially if you are a mom or soon to have baby. So here we go with Dr. Jennifer Anacker and the fourth trimester. Hi, Dr. Jennifer Anacker. Thank you for joining us today on the Fearless Family Health Podcast. I am excited to chit chat about this topic, the fourth trimester. So I've had 4 children. Yeah. And when I had my first child, I hadn't even heard of the fourth trimester or what that was about. And man, it hits you hard once you get into that fourth trimester. So tell me what it means to you and what the fourth trimester is about.
Yeah. So first off, Dr. Cheryl, just thank you for having me on today. As you gave my intro, obviously I'm a chiropractor. I don't personally have any children myself, but it's a huge part of my practice is pregnant moms. And so, just like you said, for your first, maybe you didn't even hear about it. And it's a conversation that's coming up a lot, where it's coming up a lot in the birthing community. It's coming up a lot with moms that have the experience and how could I do it differently, or asking different questions. There's books that are coming out about it that are really just spot on for a mom to be reading. I think that just in our culture that, the first, as you're pregnant, that you're preparing everything, right? Like, what do we put in the rooms? What do I get them? What kind of providers do I need? There's just so much busyness in that prep end that you think, once the baby comes, maybe not things are over, but you've just prepped so much, you'd almost forget that you need to prep or at least have some thought and conversation about who's going to help you for those next, that fourth trimester after the babies come, on average, those next 40 days, culturally. It's also interesting, if you dive into this topic, you'll see a lot of different cultures do it differently, and I will tell you they do it better. And historically, it's a part of who they are in their culture, that they just know from past generations how to better take care of moms, I feel like, than what we do in the United States. But hey, there's the conversations coming up, which is awesome because people are diving into this conversation and moms are figuring out how to ask for help or how to set up kind of their team of who they need and what they need surrounding that fourth trimester. So the fourth trimester, by definition, again, is just after the babies arrive, that next 40 days, how to nurture the mom. And yes, to the baby, but sometimes we forget about the mom. And if mama's not feeling good, the whole house isn't good. The baby doesn't get what they need. So again, that culture of how to take care of mom, yes, to baby, but, even just having, whether it be your mother or your mother-in-law or your sister come in and take care of you. So that way, then the mom can take care of the baby and have everything that she needs.
Yeah. I mean, that's so important because I take care of moms and even myself. You prepare for that birth, you prepare for pregnancy, but you don't really prepare for those first weeks, days, even months, up to a year even of time after you have that baby. It's kind of an unknown. So, I mean, even when I take care of moms and they're in their 32nd week, I'm like, have you started reading things about like breastfeeding and about, taking care of your body after you have the baby and eating the right foods and having the right support system? And sometimes it's just deers in the headlights kind of look, but
like I'm just, their only thought, I feel like sometimes, which I get, because that's the next thing is, how am I going to do this birth? That is just, how am I going to do that? And then past that, I guess I'll just figure it out, know? And I think too, for us just being chiropractors or whoever your providers or people are, is for us to really work on building our resources, because when a breastfeeding issue does come up or a birth trauma did come up or the baby's colic, whether it's in our office or who do we have as resources, that also kind of creates the tribal mentality of, we know people that will help to take care of you. And it's so fascinating to look at culturally what goes on in the United States. I think I just enjoy reading about cultures and different ways that people do things. That just even talking about, I think one of the challenges too is what, some of the challenges are, women are having babies later on in life. I think on average, it's like age 27 in the United States, and then like age 31 in Australia, as an example. So, you've gone through a lot of women that come into our offices, instead of having babies earlier on, might have been checking these boxes like, okay, graduated from high school, graduated from college, went and got the job, moved up the ladder, got married. Wow, now it's time to have a baby. And you're already saying yes to a lot of things. And how do you, I think women feel this pressure to say yes to all things, right? And so, there's that other element of, I've got to still keep all these balls in the air, but they forget that fourth trimester, they really have to drop the balls, take care of yourself, and come back to those things. And I think in the United States, our culture also financially doesn't always give moms that break, whether it's, taking time off. And there's a lot of stats that are, not totally surprising, but a little bit mind blowing about how, a certain percentage come back after, I think it's like 25% in the United States go back to work after 4 days after having, or I'm sorry, 10 days after having the baby, and that's not enough time to heal and bond. But just financially, how, to have that money set aside or not have that available. Maybe there's a lot of small business owners that just think, I got to get back at it. There's a kind of a status symbol in Northern cultures. Like, I'm independent. I've got this, watch me go, let me get this done. And they forget how important it is to rest, because that determines who you are, not only for the next 40 days, we'll say, but if a mom's depleted, like you said, a year, sometimes you'll read stuff and it'll be like, okay, a year, 2 years, 5 years, 10 years, that could determine the mental health of a mom, even if she has postpartum depression. Like, what does that look like for the next child and the next child? If you're depleted, going into a birth, after you maybe hadn't recovered from the last one, that's another tricky conversation too.
Yeah. So it's hard. It's hard in this culture, I find. And I've spoke about this with other podcast guests and just people in general, that the support that we don't have for honoring this time is just, it's not there in our culture. And then our society doesn't, we maybe get 6 weeks off.
Yeah.
And it might or might not be partially paid. So that's a struggle with people who are just having a hard time making ends meet. So you mentioned other cultures doing things. What are some of the other cultures and what kinds of things are they doing?
Yeah. I mean, you have like, even you can talk about a lot of different things. You could just go the financial route. And I had presented on this topic to the birthing community earlier. There's some research even in talking about, it's interesting. 1952 at the United Nations, like a birthing community or committee, where they talked about they required 40 weeks off paid for the moms. And then they found that in 2005, when they re-looked at it again, a researcher did, that he found that out of the 173 countries that were in this United Nations International Labor Organization, that only 4 lacked maternal paid leave, which were Liberia, Papua New Guinea, Swaziland, and the United States. So that even just, financially talking about that conversation, or even like for you, Dr. Cheryl, you could probably talk a little bit about the difference of your, birth country, home country of Canada, and how they do things differently on a financial level. But you've got also not only on the financial level, but you also have countries like a lot of the Asian countries, whether it's China, India, Indonesia, Malaysia, they all really have in their system set up for how to take care of the moms, where it's, kind of this wise woman, where the mother-in-law, that they come back, to take care of the mom, or maybe the mom then lives with her parents or in-laws for a certain period of time. And so that way, in all of the cultures that you'll see that I talk about, that they take away that, mothers should rest, and I've got the laundry, I've got the dishes, I've got, the other kids in the house. And so they come in and there's that taking care of mom piece. And then also you see it not only in the Asian countries, you also see it in some of the African countries. And then the Aborigine or the Native cultures too, where some of the reading that I have done about this topic, that the Aborigines in Australia and some of the Native cultures, for example, in the United States, where they have that piece. Number one is take care of moms. And then you also find, whether it be, you can see like it's based on where they live, but you'll see common themes about, warming foods, soups and herbal teas and stews. And, if they live if they're countries near an ocean, they might have seaweed to be part of that, or just really nutrient dense warming pieces. And as far as food goes, and then you'll also might see like some kind of warming the body type technique, whether it's, like Chinese medicine or Ayurvedic original, or Native Americans use a lot of fire and smoke, where it's like, it might be a sweat lodge. It might be putting a fire, stays on for X number of days, so it's interesting to see how they take care of the moms, the extended period of time that somebody comes to take care of them. And then you've got the food piece. And then in some of them too, there's I'll say the power of touch, the loving touch. So it might be using warm oils to massage mom. It might be some type of ethnic self-care, whatever's maybe native to their culture. So, and then just that bonding of having, when you're having a hard time, somebody who is, the mother figure, I'll say, or the grandmother figure, to say, hey, it's okay, you're fine, let me take care of that. Let me, you're healing, the hormones have changed, just somebody there to take care of you creates that different change. And I know my sister, her in-laws are from Caracas, Venezuela, and her mother-in-law, I'll say moved in for like 3 months and took care of my sister for both her first and second child. And so a lot of, like this is a Latino culture, but it's like, of course she was going to come up and take care of her. And, and it was beautiful for this example of seeing how her mother-in-law Lourdes was like, did all the cooking, did all the cleaning, make sure her needs were met, made sure that she could stay in the bedroom with the little one. And I thought, this is great. So, and I, thinking about too, how maybe we don't have that in our culture. So I think discussing it and having this conversation says, hey, maybe I'd like something like that. Maybe it's traditional, like your mother, or maybe it's getting a postpartum doula, or maybe it's asking a sister or a friend, or breaking up the chores of whatever, having people write a list to say, somebody says, hey, can I help you out? and you feel like I don't want to be rude or, but they did ask. I mean, I always teach moms just to already have a list. Like, hey, if you really want to help me out, you can take a look at the list and see if there's anything you want to do. It might be sweep the floor, pick up the kids' toys, or I don't know, whatever that, fold the clothes, whatever that list is, because people do want to help, but they don't always know what role they play. So hopefully this podcast or this dialogue will be helpful for moms to say, okay, how do I, who do I want on my team afterwards to support me? And what does that look like? Are they family members? Are they people who are trained? Are they people who are friends? Who are those people that you can have tribally around you to help you out with any needs that you have?
Yeah. And ask other moms who've just had babies, like, what did you need most? Right. Because a lot of times if you're a first time mom, you don't know what your needs are going to be. And reaching out to your community in that way. But I think hopefully with this podcast too, it will at least give women the courage to reach out and know that they can ask and they should ask, and you don't need, and you probably shouldn't do this alone.
Yeah.
Because a lot of times, like in our society, our culture says, you need to do everything alone. You need to be independent. You need to be strong. You can be superwoman. And so I find some people, not all people, have a hard time asking for that help or feeling like they are letting their family down by asking for help. So,
or putting somebody out. Or I think the other hard part, I just saw a mom last night and I saw that her, I think the conversation too about maybe where you were before the pregnancy, if you're this real type A and your body's been in what we call, in chiropractic, we're always talking about, being in the sympathetic nervous system where your body's in this go overdrive. And I saw how her body was really challenged being in overdrive, I'll say, and starting to have this conversation about, maybe just taking more naps or taking time for yourself or, just all the things to rest. Right. And for her, it was like unheard of. She's like, oh, no, I do life just fine. And I was like, okay, I'm just going to drop some seeds here. But I think if you've always done life full force and you've never asked for help, that can be, you have to kind of exhale and look at this situation and go, okay, I'm going to need to build up that skill set to ask for help. Who do I feel comfortable with? Or at least, like you said, asking those questions to another mom to say, okay, this may or may not be what happens, but if I have any troubles with breastfeeding, here's a lactation consultant, or here's, who are those people?
Yeah. And so you mentioned chiropractic care during, end of the pregnancy and the fourth trimester. How important do you think chiropractic care plays in this role of postpartum care?
Yeah. So, I live in Boise, Idaho. So I have always felt that this was really important. This is, chiropractic care is that part of taking care of mom. Obviously, just thinking about what led her body up to this point is that, she had to adapt and change into X number of pounds of weight difference and what that meant posturally and how her body, kind of slowly, but also at certain weeks and months more than, but just a large adaptation period that happened. And again, what was going on during the pregnancy, but a lot of times, what was also going on with mom's body beforehand. So there can be a double challenge there. And that was so many changes that happened. And now her body's trying to figure out, what is my new normal? What does it look like posturally? What if, there was a heightened situation that maybe happened, or something's a challenge with the newborn. That the other fear with chiropractic is we want to, yes, get your body physically for where it needs to be, but also balancing out that nervous system means that for my moms, I don't want their bodies to be stuck in sympathetic overdrive or this, burning the candle at both ends. So the chiropractic piece is really important. And in my office, it's just something that I've just near and dear on my heart, is that my mom's at 38 weeks, get my cell number. And so that means that I do house calls where I will go in after the baby's been born. And most of the time adjust mom and baby, sometimes just mom or baby, but most of the time it's adjusting both of them to get their bodies reset for physical, emotional, chemical, all the adaptations that are going on. There's such a drastic changes and shifts that are going on that it's just so important for mom, because we also know that a lot of the more than, or the emphasis, I'll say, might be placed on the pelvis or on the hips during the pregnancy. But now, holding, loving, feeding, that's a lot of forward head position and shoulders rounding forward. And so, the neck and the shoulders can get really tight for that nursing mom, that up late at night, all the elements of being a new mom, that it's just nice to get your body reset in the best position possible. Again, physically, chemically, and emotionally, to allow your body to adapt. And yes to the mom, but also yes to the baby, that, with the newborn, things can, position wise be happening in utero, if it's, not just, breech or being, straight, where transverse or breech or asynclitic with the head off to the side. Some of these presentations may be more than, but there's just a lot of positional things that can go on in utero, as well as nobody lives in a bubble for 9 months. So chances are at some point mom might have had some stress chemically, as much as you try to be healthy and make good choices, we still live in chemical overload in certain foods or air quality, or, just certain things that some things we can control, some things we can't. So those stressors can play out into the child's life. So whether a child has, a symptom going on per se or not, it's always really nice. I call that reset adjustment, to make sure that their nervous system too is able to adapt to whatever's going on that may have gone on before they were born, or adapting into this new world, with what's going on outside of the womb. And that can be, as you and I know, that can be such a huge game changer. Nobody has a crystal ball to say, A equals B, but when you see lots of kids and lots of families and all ages and adults and, all the spectrum of people, you see that adult problems oftentimes start when they're kids. So why not get after it early on and get to be the best version of you, and just minimize possible challenges that might happen. And then also optimize the body. So that way, when the child's going through milestones, or, primitive reflexes are coming and going, and help to eliminate some sensory issues, and just give the child the best foot forward on life. And that's when you get the true version of yourself. And that's when it gets a lot more fun too.
Yeah, it is. It's a joy to take care of families. It's a joy to take care of moms and babies. But I do find that moms are, they become moms. And so the babies get the care, but the moms will put themselves on the back burner. And I, like to emphasize with the moms that you are a symbiotic relationship with you and your child, especially for that 4th trimester. So taking care of you is equally important to their health as it is to your health. So, that's why I'm so excited to talk about the 4th trimester with you, because it's often forgotten. Like, you go into, I remember being pregnant and everyone's like, oh, look at you. You're so beautiful with your belly, blah, 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 blah. And then you have the baby and they don't even look at you and like, oh, your baby, So
that's exactly it, right? Like, don't forget about mom. Mom needs to be taken care of just as much, sometimes, if not more, right? Because
exactly.
This cute baby exists and thrives because mom exists and thrives and does well with her own body. This just reminded me this morning as I was taking care of a patient, just kind of talking about, the importance of taking care of mom. This wasn't a 4th trimester mom, but she has a couple of little ones, and she knew she needed to be adjusted because she started to get grumpy towards her kids. That just wasn't rational. She's like, I know if I'm off, I'm a better mom if I'm getting adjusted. I'm like, can you record that and just kind of play that back a few times for, other moms to listen to? It's okay to take care of yourself. You're better for it, as the matriarch of the family. So.
Yeah. And it extends beyond the 4th trimester for sure. Taking care of your health, you're going to benefit your family. And that's a hard concept for some people to wrap their heads around at times. And even I was guilty of that with my first child. I have learned and evolved and grown over my 4 children. I burned myself out with my first child. I did not take care of myself. I was doing crazy things way too soon.
Yeah.
By the time I had my 4th child, it was like the best ever, because I had someone come in and live in my house and take care of my kids. And mom was there for a month. And it was like she was my first child because I was taken care of. And of course, I was getting checked and adjusted and eating well and having people bring me good, nutritious food. So all that kind of stuff. So I'm just hoping that people don't have to learn from my mistakes. Just learn now what I tell you about my 4th baby, what I learned, do that.
Well, and I think even just, taking care of yourself, having nutrient dense bone broth, soup, stews, just healing the body type food, basic foods, whether it's somebody's preparing it, somebody's visiting that'll take care of it, or you made freezer meals, or you made bone broth and have it frozen. Just a little bit of prep, I feel like, can give you that exhale to just at least, arrive after, the birth and be like, okay, here, now where are we at now, kind of thing. That just a couple of little pieces, asking for help and a little bit of prep or a little bit of knowledge about how you could go about even just getting bone broth or having some things on stock, or I don't know, there's just some simple things that I think if you put in place, it'll just allow you to heal that much better. But definitely asking for help is, and there's a lot of things that not only, whether you're in the 4th trimester or not, and I'm sure you probably feel like this as a contrast of where you've evolved, you said between the 1st and the 4th, when I was presenting this to the midwives and doulas in my community, I also took in that there was, I would present one piece to it, and then I would talk about too, like, what can we as providers take from, getting good rest, or, eating good foods, or there's a lot of messages, I should say it this way. There's a lot of messages in that 4th trimester that we can take back into our own lives. Like, okay, it's okay to have downtime. It's okay to, take a time out when you need it and heal and have better rhythms and better self-care. And, what you put in your body is who you are and how your body exists. So if you're putting not so great stuff into your body, you're not going to show up as the best version of you. And if you're not taking care of yourself, then you get run down. And, there's just a lot of messages that are about the 4th trimester that you can kind of step back and reflect and go, okay, I need to get a few things situated. I need to ask for help. I need to, put in different recipes or systems or whatever that is, because the message is too that it's tricky when you live in a northern climate, that there's a lot of research and studies that talk about, or just people just know, like when you talk about living in some of these northern climates versus maybe a more Hispanic Latino culture, just as a contrast, they're big families, take care of everybody. And when you live in these cooler northern climates, that you've got, immigrants that came to the United States, we'll say, and then they're very independent versus being dependent, which is, like we've been talking about, like that's not necessarily a sign of weakness, is to ask for help.
Yeah. And it is a concept that is sometimes hard. And this can even be, I think, transferred over into men, because I think men are in extreme sympathetic overdrive and are really not going to ask for help, because if we think it's bad for women, this independent productivity push, it's 100 times worse for men, probably. Yeah. So, and having 3 boys, I can also already see that.
The pressure and again, how to have the conversations. And I think, also at times I always say to my patients, when you're on, you're on, but when you're off, you got to be off, And so, I don't know. It's just, it's a great conversation to have on all levels. And I know you probably have the same things constantly in your practice, just saying, okay, motor up, but then you got to motor down. Like, yes, you have to pay your bills, but you got to slow down. Yeah. I know I saw this great quote from Brene Brown, the author, the other day, and it could be applied to this, but it also could be applied to life. And it says, it takes courage to say yes to rest and play in a culture where exhaustion is seen as a status symbol. So there's a huge take home to that.
Yeah. So I was going to ask you one more question. Maybe that's one good one to end on. I mean, that just sums it up. And really, it is take courage, and it takes, coming outside of your comfort zone to do those things. Yeah. Well, thank you, Jennifer, so much for joining me. If you have any resources or tips or any links that you want me to put in the show notes, I'd love to go over that.
Do you mind if I have, I'm going to give you 3 books if you're cool with that. And we can put them we can put them in the show notes as well. But these were definitely my 3 top picks as far as just great information. Some of the things that I pulled from came out of them, and or moms have told me about them. My favorite one is just called The 4th Trimester, and it's by Kimberly Ann Johnson. And she does a really great job of kind of breaking down into the 5 components of like taking care of mom, loving touch, having women or, our caretakers around you. And so she has some great dialogue. She incorporates her own birth into that book. Sometimes as you're diving into this type of information, I've heard a few podcasts with her being interviewed, and she's fantastic. There's another book by, hopefully I say this right, Hengou, Hengou, who is a Chinese woman in America, but her, maybe she's first or second generation. And she does an awesome job explaining and giving you some insight in like Chinese culture, as well as it is also, she also has recipes in there. So she also has a cooking aspect to it. And that's fantastic. I've made a few recipes for just some of my friends that have become moms.
What's the title of that one?
Oh, sorry. The First 40 Days. Okay. And the first 40 days, the essential art of nourishing the new mother. But the first 40 days, all these I think I bought on Amazon, of course. So, and then the other one is the conversation about postnatal depletion, which I think is great for all moms to think about. One thing we didn't touch on is also, what have you learned maybe from your first, and how to do more preconception work too. That's also something for another time that I'm passionate about. But this is an interesting conversation. This book is called The Postnatal Depletion Cure, and it's by Dr. Oscar Sirleach. And I think he was a medical doctor out of Australia. And so he's got some interesting dialogue about, again, just, yes, the postnatal depletion, but you could think about this in the context of how do I make sure that my body's sufficient. So those are 3 of my top books on this topic.
Awesome. Thank you so much for sharing those. Because I have more stuff to learn and read all the time. That's what this is all about, is shedding the light and giving information to people. So
absolutely. Thank you so much.
Any final thoughts?
Whether it's the 4th trimester, you have multiple children or no children, step back, figure out how to take good care of yourself. You only have one body, one life. Figure out what those things are that you need to add or subtract. Oftentimes in our culture, we need to subtract or ask for help. And you're only going to be a better version of yourself for it. And whoever you serve, whether it be a business or a family or you're a caretaker, that's a better version of you when you take good care of yourself.
Beautiful. Thank you so much, Jennifer, for joining us. I will share all of the show notes and the resources and links with this podcast. And again, thank you and have a wonderful day. Thank you guys for joining us.
Thank you.
Thank you for joining us on the Fearless Family Health Podcast. If you like what you hear and want to hear more, please subscribe to upcoming casts and rate us on iTunes. Also, don't forget to share it with your friends so we can all be fearless.